Okay, so cases are up, but hospitalizations and deaths are staying low. So what's going on? Is this something we need to be concerned about?
Most definitely. I mean, the numbers are going up, but we have to understand that people are faring better now. And a lot of it has to do with the fact that the majority of our population now has some immunity, meaning either we've contracted COVID and developed those antibodies, or we've gotten our vaccinations, or we've done both, which is the case for most people. So overwhelmingly, the cases are up, but the symptoms are down, and there's much less of a chance that people will get sick and require hospitalization and or lose their life. But we have to remember that vulnerable population of the elderly and those with chronic medical conditions, they're still at a much higher risk. So we still need to be on the lookout.
Dr. Quinn, should people still be taking precautions like wearing the masks and social distancing? I seem to be seeing more people wearing masks again.
Well, you know, overwhelmingly the CDC, all the organizations that come up with the guidelines, they're looking at the risk versus the benefit. And what's being advised right now is to know your personal risk. If you're somebody that's elderly, if you're somebody that's not been vaccinated, and or if you're somebody with chronic medical conditions, then it's more advised for you to wear the mask than someone that's younger without any health conditions. Also, you have to think about, who do you live with? If you live with your parents and maybe they're older, or an uncle or an aunt or grandparents, and they might have chronic medical conditions, understand that you can still contract coronavirus. You can have very low to no symptoms at all, and you can serve as a carrier, and you can take it back to your loved ones. So these are all things to consider when you're deciding how safe that you want to be as an individual.
Dr. Quinn, real quick, this weekend the federal government ended requirements for travelers to have a negative COVID test to come into the United States. Was this premature, or do you think this was appropriate?
You know, I'm not very excited about this. I'm worried, because what you have to worry about is one community potentially spreading to another community, which could be Mississippi. And the problem is some of these metropolitan communities, like say a New York or even a London, England, or a different country that's more populated, when you allow people to go from one community to another without being tested, there's a higher risk that they can transmit it. But also think about different variants. Variants are different than the original strain, and sometimes these variants might be more virulent, meaning causing more severe disease, more infectious, meaning it can infect people more easily. This is something we have to worry about and take into consideration. And there are a lot of discussions that are going on with the CDC and other organizations that are coming up with these guidelines. But I do highly suspect that there will be some changes to the current status that we have right now. And some of these mitigative measures will potentially come back into existence, such as wearing masks and more testing. So we just have to be alert and understand, but also remember, know your specific individual risk factors.
Got it. All right, very good advice. Yeah.